Well, the emergency session earlier this week was intended to accomplish two things. One, to set the terms of the financing deal for the construction completion of the Okemah Medical Center and the instrument that will be the construction documents for and the funding for the UFALA joint venture with the Indian Health Service clinic project. That was one of the bills. The second was the operational money appropriation that will, or authority that will allow us to now utilize funds to pay some of the pending debts that were in the healthcare system since October 1 and pay those back bills that we owe, so that as we go into 2017, and the budget for 2017 is a balanced healthcare budget, we kind of wipe the slate clean and start 2017 fresh for operations. Right. The third thing, I guess, that was accomplished with the action Tuesday night was the repeal of TR 16-045. That was either in February or March, that allowed the health department to restructure and for us to access a loan. Now, this section of restructuring is the only component that remained. The council took action to repeal 16-045 because it's no longer necessary. Now, as we kind of move forward from that date to today and this week, there is a gap of about 6 months or so. The reason that we had that gap is that we've totally restructured how we would borrow money. And what we have moved to is a loan management agreement, otherwise known as a letter of credit. That's much different than what we had before, which were basically term loans, 5-year term loans, and at the end of 5 years, a balloon payment or restructuring of the remaining debt that we would owe. We had to work with two different lending groups, and both of them are a consortium of banks. And so when you are dealing with a consortium, every party involved had to approve it. So the length of time was to satisfy all of those people that represented institutions that were part of the loan agreement and the new one as well, because Bank of America Merrill Lynch is who we were moving to. So, I think it's to the credit of Bank of Oklahoma that they were open to us changing the terms of things and moving to another institution for this purpose here. So the line of credit doesn't mean that we're going to fully utilize $90 million. It's available up to that limit as we need. The other benefit of the loan management agreement is that we only pay interest on the money that we draw down. And so the interest is set at the time that we draw money down. For instance, as I spoke about the bills we have to pay, we will pull money down to pay those bills. And then we'll also pull down the construction money at some point. And we'll have an interest set at that. Overall, the interest is lower under the loan management agreement than it was under the balloon 5-year agreement. Bank of Oklahoma will still be involved because they were the initial party to finance the medical center in Okemah. They extended the date to June 30th, 2017. By that time, we will have the hospital and clinic completed in Okemah. We'll have it occupied, and then we'll continue to pay on that loan that we have through Bank of Oklahoma. The Bank of America Merrill Lynch loan management agreement will be enforced probably by the end of today, and it's a more open lending document that allows us more freedom and less interest. Now, some people may be confused and say, why are you going after a $90 million loan? You had this authority in February or March under the previous resolution. And so the answer is we're not going after $90 million and will not be spending an additional $90 million. That instrument was already in place and had been in place since 2008. And we had not used it under the construction of the River Spirit Casino, but that instrument being available to us has now been updated and simplified, so we will use it as we need it. And so if our total cost of construction and operation that we see that we need is only $65 million, which we anticipate, that's all that we will draw down. And then the remaining part we will never pay interest on. It's pledged with a permanent fund just like it had been since 2008, but we don't take anything out of the permanent fund. The permanent fund monies continue to draw the same interest it did last week as it does this week, and we'll still have money coming to the tribe from the interest. So nothing is really, nothing in fact is taken from the permanent fund. The permanent fund is only pledged in case we should have some default or something like that, that's the protection that the lending agency had from 2008, and the same thing that the Bank of Oklahoma utilized in the initial 5-year loan for Okemah. The National Council called an executive session, and they asked me and the second chief and the controller to remain. We did. The purpose of going into executive session is to hear some of the concerns of the council members, but sometimes we talk about information that, if released to the public, kind of puts us in a position where we could be compromised in any future deals that we do, because it does at times could touch upon the net value of the tribe and things like that. So we went into a short executive session. Questions were answered, and then immediately the executive session ended, went back into regular session, discussed the bill, and the bills were passed. Well, I think several things I'd like to add to our citizens is one that the lending instrument that we have is probably the best instrument that we could have had. The interest rate is very low. It's going to be at present less than 2%, and it still allows us to proceed with the construction of the Eufaula Clinic and hopefully begin that construction by November. It also provides savings to the tribe because we avoid a number of fees that we would have under conventional lending. And those fees can be significant into thousands, if not hundreds of thousands of dollars when you're dealing with millions of dollars of loans and a number of banks. So by going to this loan management agreement with one entity, we avoid the fees, have a lower interest rate, and so the benefit to the tribe is that we're doing the best that we can. Even if we have to borrow money, we're doing it at the lowest rate. We don't have to go back in for refinancing every 5 years, and there's less disruption. I think more stability, not only internally for us, but I think if the public were to look at that and evaluate us, they would see that we're on pretty sound footing as a healthcare system in terms of our money, and not see any spikes up and down, of a fluctuation of our value. So it gives us some stability, I think, for the system as a whole. It gives us confidence too that now we can move forward and not be worried about, do we have to go seek other loans and things like that. So in the end, everybody benefits, and I think as stakeholders of the tribe and citizen myself, I think it's a great deal because we obtain the money, but we don't have to pay as much money as we would have had to pay in the past. As we go forward in the health department, And the bills that we have been discussing are, very specific health bills. It provides us the operational money that we need. The Eufaula Clinic, as an example, is a joint venture with the Indian Health Service, and so in order to have the joint, in order to have a joint venture, we had to come up with a construction cost. They share with us the operational costs for the next 20 years. So it provides us an entry into money that we would not have had access to before. That provides stability, allows us to expand in Eufaula, and we can provide more services to more people there. So that part, as we move forward, is very sound. The Indian Health Service is in full agreement with us. We've talked to them about that, and we're ready to go now that we've got the instrument in place. The other part of that is that we do move forward with Okemah. It's still scheduled to be completed in the end of this end of this calendar year in December, and we opening shortly thereafterward. And then it allows the health system to grow. As they grow, it allows us to have access to more revenue through third-party billing and agreements with other healthcare organizations and potential grant money that will help us not only just to meet our operating cost, but to also hopefully have the profits to begin to pay that back. Now, originally the tribe would use its capital fund to pay back that loan, and I think you'll probably see a combination of that plus some healthcare money coming in. We've seen our third-party collections grow significantly in the last 6 months as they've worked hard to identify more alternate resources. We'll continue to work on that, and then as the hospital is open, more business coming in, that's how the healthcare system operates as a business. And it really is a business because we have 2 community hospitals in Okemah and Okmulgee. So it is a business, and it just hasn't made money in the past. The restructuring authority that we continue to need will allow us to make those changes as we go forward so that the system operates efficiently.